8 medications linked to an increased risk of dementia. Memory loss is often seen as an inevitable part of aging, but recent research shows that this isn't necessarily true. While aging does bring changes to the brain, dementia and significant memory decline aren't guaranteed outcomes. In fact, we can preserve cognitive function well into old age if we take the right steps to protect our brains. However, one often overlooked factor in cognitive decline is medication. Many common drugs, considered essential for managing various health conditions, have been linked to an increased risk of dementia. So, why do some medications, which seem harmless, have such severe long-term consequences? And how can we protect our brains while managing other health issues? These are critical questions, and in this video, we'll explore them in detail. First, it's important to clarify that we're not here to demonize medications. Modern medicine has improved and even saved countless lives. However, just as it's vital to understand the benefits of medication, it's equally crucial to recognize potential risks and learn how to mitigate them. With that said, let's dive into some of the medications that may silently harm your brain. The silent threat: omeprazole and anticholinergics. Let's begin by looking at two classes of drugs that, while widely used and generally safe in the short term, can cause significant damage with long-term use. Omeprazole and anticholinergics. Omeprazole, a common proton pump inhibitor, PPI, used to treat heartburn, reflux, and gastric ulcers, seems harmless. However, several studies have revealed a disturbing link between prolonged use of omeprazole and an increased risk of dementia. In one study involving 6,000 people, 10% of those who used omeprazole for more than 3 years experienced noticeable memory loss. Another study found that 33% of patients who took the drug for over 4 years reported cognitive issues. How does this happen? Omeprazole may interfere with vitamin B12 absorption, a nutrient essential for brain health, and alter gut bacteria, both of which can affect cognitive function. Next, we have anticholinergics, a class of drugs used to treat conditions like allergies, depression, and urinary incontinence. These drugs block acetylcholine, a neurotransmitter essential for memory and learning. Prolonged use has been linked to a significant increase in dementia risk. For instance, a study by the University of Washington showed that individuals who regularly took anticholinergic medications had a 54% higher risk of developing dementia. Common examples include diphenhydramine, amitriptyline, and oxybutynin. If you're taking these medications, it's crucial to consult with your doctor about safer alternatives. Corticosteroids and benzodiazepines. Hidden dangers now. Let's turn our attention to corticosteroids and benzodiazepines, two other classes of medications that, while effective in treating various conditions, can have a significant impact on brain health. Corticosteroids are widely used to manage inflammation in conditions like asthma, allergies, and autoimmune disorders. However, long-term use of corticosteroids, especially oral forms, can lead to cognitive decline. Studies show that prolonged exposure to these drugs can cause structural changes in the brain, resulting in confusion, depression, and even dementia. One UK-based study found that individuals using corticosteroids for asthma had a much higher risk of developing dementia over time. This is due to their impact on cortisol levels, a stress hormone that, when present in excess, can damage brain cells. Similarly, benzodiazepines, often prescribed to manage anxiety and insomnia, carry significant risks when used long-term. Medications like alprazolam and diazepam can effectively reduce anxiety symptoms, but studies show that they are also linked to memory loss and an increased risk of Alzheimer's disease. One alarming study found that over 40% of long-term benzodiazepine users reported cognitive issues, including difficulty concentrating and increased sensitivity to stimuli. If you rely on these drugs, it's essential to explore non-pharmacological alternatives with your doctor. Amphetamines and first-generation antihistamines. Unexpected surprises. Moving on. Let's talk about two medications that might surprise you. Amphetamines and first-generation antihistamines. Amphetamines, such as those prescribed for ADHD, are known for their ability to improve concentration and focus. However, long-term use comes with risks, including memory loss and cognitive decline. Amphetamines increase levels of neurotransmitters like dopamine and norepinephrine, which can temporarily boost mental function. Yet, prolonged use can lead to dependency and even permanent brain damage. This means that while these medications may help manage ADHD symptoms, their long-term cognitive effects must be considered carefully. Meanwhile, first-generation antihistamines, such as chlorpheniramine and diphenhydramine, are commonly used to treat allergy symptoms. Although effective for short-term relief, they too can pose a threat to cognitive function if used over extended periods. These antihistamines block acetylcholine, which, as mentioned earlier, is vital for memory. Prolonged use of these drugs has been linked to a higher risk of dementia, making second-generation antihistamines like loratadine a safer option for long-term allergy management. Tricyclic antidepressants and statins. The unexpected culprits. Finally, let's address tricyclic antidepressants and statins, two classes of medications often overlooked in discussions about cognitive health. Tricyclic antidepressants, like amitriptyline and nortriptyline, were among the first drugs developed to treat depression. Although they are effective, their strong anticholinergic properties have been associated with an increased risk of dementia and memory loss. Studies have shown that patients who use tricyclic antidepressants for extended periods experience faster cognitive decline compared to those who don't. Fortunately, today there are safer alternatives, such as selective serotonin reuptake inhibitors, SSRIs, which have fewer side effects and are not linked to memory problems. Lastly, statins, widely prescribed to lower cholesterol, have sparked debate over their impact on brain health. Some studies suggest that statins may protect against dementia, while others show that they may cause memory problems in certain individuals. It's thought that statins might interfere with cholesterol production in the brain, which is vital for cognitive function. While the evidence is mixed, if you're taking statins and notice cognitive changes, it's essential to discuss your options with your healthcare provider. To sum up, while these medications play essential roles in managing a wide range of health conditions, it's vital to be aware of their potential impact on cognitive function. If you're taking any of these drugs, don't stop suddenly, always consult your doctor. Instead, work together to explore safer alternatives or ways to minimize long-term risks. Remember, the brain is our most precious asset. By staying informed and making thoughtful decisions, we can protect our cognitive health for years to come. Thank you for watching. If you found this video informative, please like, subscribe, and turn on notifications for more content on health and wellness. See you in the next video.